Are you ready? Because here comes 30-Minute Medical. My first guest is Fred Lewis, and Fred is joining us today on behalf of the Radiology Department at Conway Medical Center. He is the director of that facility, and I bet you that you have kind of blossomed since this facility opened. I bet you're learning a lot of things that you didn't learn in school.
Every day is an ongoing learning process for us all, Diane. Thank you for bringing that up.
How has that changed for you? Because I know that every day, as we said, this is an explosive field. Every day there's something new that takes us inside the human body without surgery.
Well, I've been in the field for 25 years now, and the changes I've seen have just been phenomenal, leaps and bounds. Years ago when I first started, it was not uncommon at all for they have to do exploratory surgeries to find out what's going on with the patient. Now with the imaging tools that are out there, we're able to make diagnoses practically on the spot.
So many times we hear the terms PET scans, CT scans, MRIs, and I don't know the difference, Fred, so why don't you start there by educating us?
Okay, a CT scan is computerized, or CAT scan is computerized axial tomography. The CAT scan is like taking the human body, comparing it to a loaf of bread, take out a slice of the bread, look at it from the flat side. So you get a two-dimensional image in a three-dimensional plane. CT is very useful in diagnosing problems in the brain, in the chest, the abdomen, the pelvis. A very common study. It's particularly useful in diagnosing trauma patients from the emergency department. So CT is very useful. It's a relatively new imaging modality. It's been around since the late 80s, and very heavily used now. MRI, or magnetic resonance imaging, doesn't use any radiation at all. It uses very intense magnetic field, which causes the molecules in the body to line up in a north and south direction, north and south poles, just like the Earth's own magnetic poles. The magnet we use is actually 30,000 times more powerful than the Earth's own magnetic field. When the magnets turn on, it causes all the atoms to line up in one direction. We bounce radio signals off of the body. The atoms at that time become little radio transmitters and bounce their own signals back. We have receivers that pick up and record the information that's bounced back, and then high-speed computers convert that image into a digital image, or that information into a digital image. MRI is, you may have heard, if you're claustrophobic, it's probably not the thing you want to do, but it's a very tight tunnel that you sit in, although there are open scanners out there now. But it's very useful in diagnosing problems in the brain, in the soft tissues, the nerves, studies like that. You mentioned PET-CT a while ago. It's one of the latest modality that we've added to Conway Medical Center. It's a hybrid between a nuclear medicine camera and a CAT scan. We inject you with a radioactive dye, radioisotope we call it, and we scan you the PET part. It's Positron, Emission, Tomography is what that stands for. It measures the radiation that is coming from your body once again, puts it on a camera. The hybrid with the CAT scanner, the beauty of that is that we're able to merge these two technologies together, the PET scan and the CT scan, into one image. The beauty of PET is that it records or picks up on very active growing cells, cancer cells. Cancer cells require a lot of glucose, a lot of sugar, to grow the way they do. So the isotope that we inject you with is tagged with the sugar, and it'll focus on that one area. Instead of being dispersed throughout the whole body, it'll focus in the one area where the tumor is, and it'll show up brightly colored on our scans. So we're able to merge the two technologies, the PET scan and the CT scan, into an overall three-dimensional type study image that the radiologist can review. They can do a progression study, do a PET scan every 3 months, 6 months to see if tumors are growing or if how they are responding to the therapies.
So obviously you're catching disorders a lot earlier.
Yes.
And you're saving lives.
Yes, definitely. That's the advantage of the imaging technologies we have now. So.
Let's take the heart, for instance. I guess if you were studying the heart and you could do this three-dimension, wow. Mm-hmm.
The beauty now at Conway Medical Center is we have a 64-slice CT scanner, which is a new technology. We've had it since April of this year. Using the 64-slice, we're able to scan through the heart in very minute increments. We are then able to do some post-processing and produce three-dimensional images of the heart where we can evaluate the vessels of the heart, which is very good for a first step in diagnosing occluded arteries, which can eventually lead to heart attacks or pathology such as that. We also can, the cardiologist can also take the vessels away from the heart and just look at the vessels themselves, or do a fly-through through the vessel looking for narrowed arteries, which could potentially lead to a heart attack later down the road.
Really amazing technology. Mm-hmm. And finally, the fact that you all are rated and certified so high is a real plus for Conway Medical Center. Mm-hmm.
The radiology department became certified by ISO in 2005. So we're certified by ISO 9001-2000 in the year 2005, which was the latest standards that ISO certified. ISO is the International Organization of Standardization, which is a quality management organization, saying that we are working with the safest equipment, we are working with the best trained individuals, and we are doing everything we can to promote and provide safe exams for our patients. And this year, we became certified under the ISO 9001-2008 standards, which we're proud of that also. We were the first hospital in the state to reach this accreditation.
Congratulations, and thank you, Fred. Thank you for this great information. I want everyone to know that when we return, we're going to continue our conversation talking about radiology, but more specifically mammography. We're going to talk about breast cancer, and I want to thank Fred for being with us.
Thank you
because
so much.
Coming up next, we're going to have Sean do. So don't go away. We'll be back.